It's been a couple of months, I think, since we last visited with each other back in March when this pandemic began to really take shape. How have you been?
I mean, listen, certainly we've gone through a lot, and the world, the United States, South Shore Health has gone through a lot. We've seen a lot of patients since I talked to you last, and there's been a lot of critical illness. Most patients have done well, but it certainly has taken its toll, and there's been a lot of resources dedicated to this. I would say right now we're certainly seeing less new admissions coming in, so that's a good thing. We're definitely on the downturn, but we definitely still have COVID patients in the hospital, and we still have COVID patients being admitted. So this is far from over.
What we are seeing playing out is that there's been a fair high percentage of seniors age 65 and older who've been impacted severely by this virus. Would you agree?
I do. I do. Unfortunately, this virus does discriminate, and it takes its toll on elderly patients with chronic conditions, and it can be particularly hard in those vulnerable groups for sure.
And in addition to the seniors who've been impacted, I think we've also seen members in our minority community who've also been impacted, particularly in our urban centers.
There's no question about that. Again, unfortunately, this virus does discriminate, and it tends to hit patients and communities that tend to be poorer in the sense that, like if you look in Massachusetts, for instance, the two places that have by far the highest incidence are Chelsea and Brockton, okay, for example. And I think that you have communities of a lot of people, number one, that are essential workers in the sense that they're on the front lines of doing things, whether it's manufacturing, whatever it is. So, and they have to work for their families. Oftentimes, they're living in places that are multi-generational. It's not a single person living in a home. Okay, so and it's often in places that have denser living areas, more crowding, and again, the chronic conditions. I think all of those have. It's true. It's disproportionately affected people of color.
What else are we discovering about this virus, particularly as it's impacting some of our young children with a Kawasaki-like syndrome?
Yeah, so Joe, I do want to say that children tend to handle this virus very well. It's very different in children than it is in older adults, but there is this rare, mysterious inflammatory syndrome that has affected likely, hundreds of children across the country. And it is, as you said, it's this sort of Kawasaki-like or toxic shock-like inflammatory syndrome. Interestingly enough, many of these kids don't test positive by the swabs, which means that they tend to be probably further out from their illness, but many of them are antibody positive. And some of them do test positive for the swab. So while we don't know if COVID-19 is the only etiology of what underlies this, we think it is the predominant one. But interestingly, we see it as the number of cases have decreased, which makes one think that this may be a post-infectious type of syndrome, where it may be the way the immune system has responded to COVID-19, and for some reason it's become exaggerated. Now, these kids can get really sick, and rarely it's fatal, but most kids, even with this syndrome, have done well with some of the new therapies that we've given.
What else are we discovering about this virus now that we've been dealing with it now for over 3 months? For example, is it transmittable on surfaces?
Okay. So it's been shown that it can be amplified on surfaces, and in cells, it's been shown that it can infect cells. So it's potentially transmissible. I do think it is, but I don't think it's still the major mode of transmission. I think the major mode is still, us face to face, within 6 feet. Within a prolonged period of time, more than 15 minutes, I think coughing, sneezing, but here's the catch, Joe, asymptomatic transmission. The person is infected, but they have no symptoms. We're talking in a close proximity. I can infect you. And that's what's very different about this than influenza or even more SARS. With SARS, which is obviously the novel coronavirus that killed about 8,000 patients back in 2003, those patients were most infectious later on in their course when they were hospitalized. And that's why we saw a disproportionate number of healthcare workers get infected by SARS. Now, we have seen healthcare workers be infected by COVID-19, but it's this asymptomatic infection and asymptomatic transmission that really sets this apart. And it makes the classic identify, isolate, trace modality, it makes that not irrelevant, but that is not going to be able to save us in the sense. And that underscores the need for that vaccination, because we have so many people who are transmitting this who are asymptomatic. The CDC has estimated at least 35% of patients who are infected are asymptomatic, and I believe that that number is even higher, and probably even higher in children, although that hasn't been proven yet.
There's talk of a possible resurgence, a second wave coming. Are we prepared here on the South Shore? Are our health systems, our institutions, do we have adequate equipment, including ventilators and other PPE, to respond should we have a second wave?
So the answer is yes and no. And the reason I say that is because, first of all, I think, as you just astutely pointed out, there's likely going to be a second wave because most of the pandemics in the past have had a second wave. Now, we don't know exactly what that's going to look like. Is that going to be a lull in the summertime and then, a big peak again in the fall or the winter? That's possible. Or are we going to see lots of peaks and valleys throughout the summer, and maybe different in different states and in different communities within the states? And then are we going to see potentially a bigger one in the fall or winter? Is it possible we'll escape this without a large rise in the fall and winter? I would say to that question, I think we're likely going to see a significant peak in the fall and winter, because that's what often happens with respiratory viruses. And we still know that even though we have more immunity to this virus as a population than we did 3 months ago, experts are estimating that at only somewhere between 5 and 15%, which we don't think is enough to stop this virus. So because the virus is still present and because we don't have background immunity, we're likely going to see a spike. Now, are we prepared for that? I can tell you in our health system, we're much better prepared than we were before. We have more space, for example, to be able to handle these patients. We have more intensive care unit beds. We have, we've done a lot with labor pool, which means we have personnel that weren't necessarily taking care of patients in the hospital that have now had experience. So remember, this is all about people and space, okay? So those two things are important. Now, as far as PPE, that's really crucial. And you've heard problems with our supply chain, not just with personal protective equipment, the masks, the respirators, the gowns, the gloves, but you've also heard problems with testing equipment. And it's possible down the road when we're talking about vaccines, we're going to hear about problems with supply chain there. That has definitely shown the United States as a whole to the fact that we have not had the domestic readiness that we've needed to be able to handle something like this. So I think supply chain problems, of which PPE is one of them, is going to be a constant vulnerability for us. And we have to do better to not rely on other countries like China, which produces 50 to 75% of the masks and respirators that we use around the world. We have to be able to produce this and manufacture this in our country, so we're not reliant on other countries that are having their own issues.
Let's talk a little bit more about the PPE, and particularly the masks and gloves, sanitary wipes, and the like. Are using homemade masks, are they adequate, at least to the extent of mitigating some of the spread?
Okay, it's a tough question. I think I am a big proponent of universal masking. okay? I do think the cloth masks are better than nothing. But my hope is that one day, sooner than later, we have the ability to give everyone in the United States, not just healthcare workers, medical grade type masks. Because when those have been studied in the past, those seem to be more effective. Now, I also want to remember that homemade cloth masks are not all equal either. We've seen some fancy ones that are very thick, and some people actually put a filter in there. Those may be different than a bandana, for example. So this is an area that we have to learn more about. But I think it's important for now that everyone who goes out into public, and if you could potentially be within 6 feet of someone else, you want to be masked. The mask protects the other person and contains those secretions, but the mask also acts as a barrier. So if that other person is sick, you'll at least have a barrier. It's not all about all or none with this virus. I think the viral inoculum, meaning the amount that hits you, probably has something to do with how sick you'll get or whether you'll get sick at all. We haven't talked about that much, but I think viral dose, viral inoculum is something that's really important. And I think the masking decreases that, even if it doesn't protect you completely.
One final question about the masks or PPE in general. As our businesses come back into, opening up in an operation, phase 1, phase 2 here in the Commonwealth, we are now beginning to see these businesses competing with our traditional healthcare institutions for masks and gloves. Are you concerned about that level of demand? And could that in any way threaten the ability of our healthcare system to provide adequately in terms of that PPE?
I am concerned about it, but let's face it, we have to think of this as a community. And the community isn't just medical providers and hospitals and offices that take care of patients. We have to think about our whole community. So while I certainly think there are certain specialized type of respirators that really should be relegated to that require specific fit testing and that should be more dedicated to healthcare workers that are taking care of patients. I think masks need to be available for as many people as possible, and especially those people with chronic conditions. Remember, if we can protect our elderly, if we can protect our patients with weakened immune systems, there was just a study that came out that patients with underlying cancer, whether you're on chemotherapy or not, there's an increased risk of death, about 13% over the 30 days after infection. That's twice as much as what we would normally think. So we really have to protect our vulnerable patients, our patients with obesity, with chronic heart disease, diabetes, high blood pressure, right? Again, remember, even though anyone can get infected by this virus, whether you're a child or adult, it causes much more severe illness, older age, chronic conditions, weakened immune system. Those are the people that need the masks the most. And we have to be masked to protect them. And we have to keep our distance. And we have to wash our hands so we don't bring it to them.
What else would you like to share in this discussion? We talked about what we know about the virus, what we have learned over the past 3 months. We talked about whether or not it's transmissible on surfaces. And we've talked about the importance of wearing masks in the absence of anything else. Can you think of anything else that you feel we need to cover?
2 things that I'd like to cover. The first is the reminder that if we get infected today, there's a good chance that you're not, if let's say it's me, that I'm in about a week or so, which is the average incubation period, I'm going to be able to transmit this virus. There's a good chance that I will be asymptomatic, but can still transmit this virus. So just because you're standing next to someone who says they feel better than they've ever felt, no cough, no sneeze, no headache, achiness, that doesn't mean that they're not infected. And that doesn't mean that they can't transmit to you. Remember that. That's one of the major importances of masking. And it's not just masking, but it's also cleaning our hands and not touching our face, okay? That's very important. The other thing to remember is that when I get infected, even if I do develop symptoms, oftentimes it's not until a week after that where I start getting more severe symptoms. So and may need the hospital. And then if I unfortunately succumb to this, that may be a week or two after that. The point is, what we're doing today is not going to be reflected for weeks or maybe even a month later. So I want people to realize that as we sort of take our foot slowly off the brake and put our foot slowly on the accelerator, we don't want to take our foot off the brake completely, and we don't want to put our foot on the accelerator completely. That can be dangerous. And although it may seem like, look, we're okay a week later, that's not enough time to know, okay? So I really want to caution people on this. And then the second thing I want to say, when it comes to the virus, we're often talking about people, space, time, and place. So people, try to avoid very crowded areas, okay? I understand the term we're using now is quarantining, where you may have a bubble of people in your home and you may interact with another bubble of people, but still, and you may not be masked. And that's okay, but I still want you to try to obey that 6-foot rule if possible. Now remember, the virus also violates that rule as well. We've heard that if you cough, if you sneeze, if you sing, if you yell, if you're in a restaurant that has air conditioning, these are things that may be able to take the droplets more than 6 feet, where you have a little bit more of airborne issues here. Okay, so we have to remember that as well. 6 feet is sort of that minimum. Okay, if you're someone who is in that vulnerable group and you're quarantining, I still recommend masks and recommend that the people, who you are bringing in would also mask, even if you're more than 6 feet apart, if there's that vulnerable group. But it is true, we've got children, they want to be together. It's hard to keep them apart. Children, they do very well with this illness. I understand it. I'm trying to be realistic, but remember, they also come back into the home. So make sure when they come back, if they have been around their friends and there's vulnerable people in the home, you want to socially distance as much as you can with them. So that's people, okay? So people, place, are you indoors or outdoors? I'm feeling better about the warmer weather when we're outdoors. I think this does slow down the virus. It's not going to disappear. Okay, if we want to challenge this virus and get really close to each other and huddle for hours and things within 6 feet, there will be more cases, but I think there'll be less than we saw before when we were more indoors. Okay, so that's people, space, time. Okay, time is really important as well. The more time you spend, so canceling the Boston Marathon, something very difficult, but let's face it, you're running for hours, shoulder to shoulder with other people, okay? You're spitting, there's a lot of secretions. That's dangerous because of that time. We want to try to limit it, especially if you're within 6 feet. And so I talked about place, and then, well, the space. The space is that 6 feet. That's important, So those are sort of the ways I think about no matter where you are, whether you're opening up your place of work, whether you're going on a trip, these are the things we have to think about and the type of risk factors you have.
Dr. Todd Ellerin, Chief of Infectious Disease for South Shore Health. Thank you so much for visiting with us again. Please stay safe and healthy and have a great summer.
It's great to see you again and good meeting with you as always. I appreciate you. Be safe, Joe.